Dr. Yates, and this is Robin. Robin works with me. She's a nurse. She runs the practice. But like Cy Sperling, she's also a patient, correct? So we are really interested in female hair loss, and we know a lot of groups really kind of, I think, ignore female hair loss, although it's such a big proportion of the population that we actually specialize in it. We specialize in the surgical, and we'll go through that, and the non-surgical, because there are always things you can do. So, Robin, since you are a patient and you've had non-surgical, correct?
Correct.
Why don't you tell everybody basically what you've had done and did it work, and would you recommend it to others?
Sure. Female hair loss is so frustrating because a lot of people don't know what to do with it, how to treat it, what to do, and females find a lot of pride in their hair, and when you lose it, it's just devastating. So I've lost my hair many times for a couple different reasons. I do have family genetics for female pattern baldness, but I also have an autoimmune disorder that causes me to lose my hair quite frequently. So I have tried everything non-surgical. I've not had a transplant. I use Rogaine, I've used a laser cap. I have done multiple PRP treatments, and of recent I've done exosome treatments on my hair. And this is the best my hair has been probably for 8 years. I don't have very good photos of when it was really thin, but here's an example. I lose a whole band up in here. I get thin all through the top, but I lose density everywhere. So here's an example of where I just had no volume, no hair. It's just lifeless. And as you can see now, my hair, is looking pretty good. So I give credit to being lucky enough to work here and knowing that there are some solutions, but these solutions do work. And we are very passionate about helping other women with hair loss.
Yeah, I'd say this is kind of dramatic in that the density, and you haven't changed any hair products, have you?
I've tried all that too. Of course, I use your hair products. They're natural and they're very healing.
Yes.
I also have a chronic itchy scalp, so the apple cider vinegar shampoo is very soothing for that. It helps
for
relieve
dandruff
that.
too.
And yeah, it helps relieve the dandruff and the flaky.
I think it's the best on the market.
There was a day where I was just covered in snowflakes from my hair. Today I've got black on and I don't see any flakes. So
You look great. What a testament to exosomes and our shampoo and our hairline. But let's talk about the surgical therapy. So you've seen us do a lot of surgery on female patients. And just to show you, this actually is not a patient, but this is what the scalp would look like. And just like in male patients, we take hair from the back and the sides and usually move it to the top. It's always good, like if somebody has an area where the part is wide or they want to do hairline work, we'll have great results. Sometimes it's not as beneficial if they're thinning more toward the back or just everything's really thin. We have options for that too, like micropigmentation, exosomes. I don't think there's any condition that I've seen come through here that we couldn't help with. So let's talk about hair transplants. So if you can zoom in, we can see, let's look at this one, just an increase in density here with a hair transplant. This is a common problem. This patient had PRP and a hair transplant as well. So what you can see is that the density is much better, and this is kind of what we see all the time with preservation of the hairline, but thinning behind the hairline. So with PRP and grafts, you can see that that's a much better kind of robust growth of hair, and just overall it's better. So Rob, thumb through there. There's some hairline pictures I wanted to show as well. So a lot of people always ask me, that's a good one, why don't women have more hair transplants? And I think the real answer is that they don't know that having a hair transplant is available to them. We do a lot of hairline restructuring. We're kind of experts at this, like, someone who would say, oh, my forehead's just too big. So you can see here we lowered the hairline to produce kind of a tighter forehead, a more feminine appearance. Also in the temples, we close the temples off as well. So instead of having recessions like men do, that it's a much more feminine outlook here.
And this is something that we do a lot of for male to female transgender clients.
Right.
So you take away the male edge of the recession and create a more rounded feminine hairline, and it's just amazing.
It's amazing, amazing. And the good thing is that I always say pictures, well, I don't say that anymore. Videos don't lie. pictures lie now because of what? Photoshop, and we know that I've heard from the dating sites, they say those pictures lie, you know? So you really can't trust pictures now. So if you're a patient, what are you gonna trust, you know? So I say the best way to find out how good somebody is, a doctor or whatever, one, ask a nurse, you know, because nurses know or ask another doctor who's worked with a lot of people who's a good doctor. And then two, if you can't do that, then you want to see a live patient, you know, or talk to one on the phone, at least that the doctor has worked on. So, you know, if you just flip through books or look at signs and all that, I'm going to say on a 1 to 10, you're going to get tricked more times than not. Okay, so we're very serious about what we do, very interested in female hair loss. So if you have any questions, consultations are free. Everybody here, when we offer something, has already done and had what you have. So it's nobody here that's going to tell you to do something that we haven't done, male or female. So we have 2 offices. We're in the Loop, we're in Oak Brook, and we're just a phone call away. Anything else, Rob?
I think you covered it as usual.
I concur. See you soon, Dr. Yates.